This is Randy Stafford. I'm from Mill Valley, California, and we're at the Snowmass Club this evening. I'm very happy to be here as a recipient of a Community Champion Award from the Chris Klug Foundation. And for me, it's been a long journey. I have first known about my kidney disease in 1982, and I've had 2 kidney transplants, first one in 1984, and then again in 2005. So it's been really a lifetime with chronic kidney disease. And in some ways, having that disease has really motivated me to not only take care of myself, but also really care about how other people are doing. So once I had my transplant and was recovered, I decided to go back to medical school. And that in itself was kind of a long journey. I was a lot older than most of the other medical students or the residents in my program. But I've continued on this track of both being interested in public health and clinical medicine. And in some ways, I very purposely decided not to specialize in nephrology, that is, the care of kidney disease. I wanted a broader perspective and wanted to be able to help more people. So my specialty is primary care internal medicine. And I have pursued that for a long time at various institutions. I've been at Stanford University for the last 21 years. And I've been at Stanford University for the last 25 years. And it's been very rewarding to kind of go through the process of moving up from assistant professor to full professor. I would say that in my last 10 years, I've really tried to focus my life, my career outside of academic medicine. So I've been involved in a lot of committees and boards, as well as taking a real strong interest in global health. And my main project at this point is organizing eye screening, that is screening for eye disease, in the nation of Bangladesh. And that's been incredibly rewarding for me. I would say it's the most, of the maybe 13 or 14 research projects I've had, it's by far the most rewarding. And so far, we've screened about 17,000 people, and I think helped at least 5,000 or 6,000 people come to some better solution to their eye disease that in some ways would never have been available to them. So I'm very proud of that project. And I know for me, it's sort of, this is what my next phase of life is all about. It's getting away from the academics and being more out in the real world, doing research as well as helping people. Well, I think early on in my life, I was interested in medicine. I got directed in the direction of public health for a while, but I really believe that there is a lot that we can do to help one another. And my transplant, the care I received and the support I received really brought me to a position of wanting to give back. And that was really a lot of my decision to go back to school and go back to school at the age of 28 after starting a career doing data analysis for a large healthcare provider. So my story really is one of pursuing a career that allowed me to combine the patient perspective with the training and skills of a physician. And I really, at this point, I feel like I've matured fully into that dual role and have lots of plans for what I can do next. And I'm very appreciative of the award from the Chris Klug Foundation because it really pinpoints exactly the sort of work I want to do in the future, which is really to be a community champion and to care about people who have chronic disease, to really promote physical activity as one of the absolutely most important thing about chronic disease management. And unfortunately, that's not necessarily a natural part of the healthcare system. So my role has always been as a patient, not necessarily satisfied with the care I was getting, and as a physician, not necessarily satisfied with the system I need to work in. So I think my vision for the future is really to make self-management, physical activity, caring about prevention as the focus of my work. And to me, that applies very easily to transplant recipients, but really it also applies to anyone else with a chronic disease. You know, I'm very appreciative of this award from the Chris Klug Foundation. And in fact, Chris has long been a role model for me, as well as for many people in the transplant community. His example really shows that taking care of ourselves can result not only in great health, but also in a great life. And so I'm very appreciative of the role model that Chris has become and continues, I think, to grow in that model, into that role of being a role model.
When I open my eyes, hope that you're by my side.